All right, last but certainly not least, the CPD research team, please come on up. So you heard a little bit about this earlier from Vince. This was really the idea of actually doing a joint research project across CMSS. The CEOs got a little snippet of this yesterday of what was started, but you're really going to hear from Alisa, Jim, not Devin, and Vince is a little bit of further learning about what we've had. Please sit, whatever you guys would like. If you guys want to come to the podium, I don't need to hang here, whatever's easier for you.
Great, thank you. Let me make sure I can. Perfect. Gotta go back. Great. Thank you so much. I'm Alisa Nagler with the American College of Surgeons, and really delighted to share with you some of the work that we've done with our CPD PPG around this research project, which you may have heard of before. So I'm happy to be here with my co-presenters, colleagues, Jim and Vince. And certainly want to acknowledge the many folks from the CPD PPG that have contributed to this research as we've been working on this for a couple of years and look forward to more good to come. We have nothing to disclose. So what we hope to accomplish in the next 12 or so minutes is to help all of us recognize the benefits of the broad participation of and collaboration across our PPG, as many of you experience with your own PPGs, to confirm the pivot that occurred in education during the pandemic, and then to really think about how that may have changed what we offer and the staff that we need because of the pandemic. As a way of background, like we said, no, it was certainly a trying couple of years, and we tried to find some real opportunity during this time. While we were meeting monthly as a PPG, we recognized this as an opportunity to learn how education had changed at all of our societies and the change in our learners, our members, as a result of the pandemic. We sought funding and are grateful for CMSS providing that funding to us. And we tried to maintain a focus on not just kind of curiosity, but how would this impact our education going forward for all of us. Again, we met monthly. We identified a small working group, which you saw on that second slide. We developed some research questions, again, that were both interesting but hopefully really meaningful to our work. We utilized, our subject pool was easy. We had all of you, all of us, and our members and learners. We've used both quantitative and qualitative data collection. We'll share with you the results of the first two surveys or questionnaires that we sent out, first to organizations, second to learners, and we're still looking forward to doing focus groups with those learners, our members. We continue to keep our PPG updated, the CEOs updated, certainly CMSS leadership and our own organizations. So our initial results from the society questionnaire, 36 of the 47 specialty societies participated. We're grateful for your efforts in this area, thank you. All, not surprising, but nice to confirm that all of us pivoted pretty drastically during those couple of years at the beginning of the pandemic. We also recognize that as a result of that, we've seen a change in the staff that we need, the staff skills that we need, and we're seeing a change, which was really our main research question, in our learner preference for learning, for education. Here's a bar graph showing the results. Again, this is the organizational survey, the society survey, where we asked whether the delivery of education was different over the last 4 years, sometimes speculating for 2022 if that hasn't occurred yet. You'll see, no surprise, that live activities, what's referred to here as courses, dropped drastically, right? We know that during 20 and 21, has come back up, but you'll notice not all the way back up. You'll see that there's an increase in internet live and in internet enduring activities. Again, that went up quite a bit, maybe came down a little bit this year, but certainly not down to where it was pre-pandemic. And you'll see the format called Other, which was established about 4 or 5 years ago by ACCME and AMA, which is kind of non-traditional delivery methods of education, that's gone up. It also includes hybrid, and we know that many of us pivoted to hybrid, and so that's where we see that increase. That has not dropped back down, as you'll see. You'll also see we asked about changes in personnel, staffing, education needs, skill sets, knowledge. And I'll draw your attention to the last two items. You'll see that staff training increased, the need for staff training increased drastically since March of 2020, and we know what that was in response to. Our meetings and conventions people had probably not spent a lot of time offering virtual education before the pandemic, and all of a sudden there's this new need for understanding virtual platforms and using Zoom and recording sessions. In addition, there was an increase in vendors that we collaborated with. Those are the platforms that we all use now to deliver our education, which again, most of us didn't use pre-pandemic. So a change in the staffing needs, knowledge, skills for all of us, I think. We asked some open-ended questions and analyzed these to look at themes and the responses. So the first, again, question to the organizations was what new knowledge or skills are needed for your personnel? And these are the themes which very much corroborate what we saw in the quantitative question and the question before. And the themes are virtual meeting production. So again, this idea that now people need to know how to produce a virtual meeting, to run a virtual meeting, to implement that in ways that we haven't done before. Faculty development and learner focused. I'm going to move to show you some of the comments from this open-ended question. So again, you'll see virtual meeting production, this idea of these new platforms, of needing AV and technology skills, having to learn to be more nimble and understanding technical capabilities. Again, something very new for our staff. Faculty development, this idea that now our speakers, our chairs, our presenters are having to present in new ways, and what is our responsibility or obligation to help them be better teachers in this virtual environment, also new for many since the pandemic. And finally, learner focused, a nice return to adult learning theory, I'd say, where we had to think about how do we engage learners if we're used to sitting in a room like this and we've moved to Zoom or we've moved to virtual formats or hybrid delivery or different kinds of education delivery. How do we make sure that we're engaging learners and that it's impactful for them, for our members? The second open-ended question was related to observation of learner preference. Again, still societies responding around their observation of how learner preference may have changed. And these were the themes we identified. Zoom fatigue, no surprise we'll look at. In-person preference with an emphasis on networking missed. People wanting choice, our members wanting a choice. They expect hybrid now. And this idea of microlearning or spaced learning. Again, if we look at those individually, Zoom is very 2020 now. It's a little bit overrated and people are tired of it. We hear that all the time. So finding new ways, of course, to meet our learners' preferences. This idea of in-person preference, interestingly enough, in most cases when in-person preference is noted, it's not around the content. It's not around the education. It's not around the substance. It's about missing the time together to collaborate, to have coffee, to see our friends, to socialize. Wanting choice, expecting a hybrid option. People have gotten used to this idea of being able to decide whether to come in person, to watch the live stream from the hotel room, or to watch it a week from now after it's been recorded. People have gotten used to that. Our learners are now preferring that option, which in many cases is a hybrid option. And finally, this idea that little snippets of education, when needed in ways that are convenient for a learner to access, is something that's become preferred because we've done more of that over time. We've gotten used to it, and again, a preference for learners. So our learner questionnaire just closed not too long ago. These are very preliminary results. I can tell you that 25 organizations participated. Thank you to those who did. We know it took a little bit of extra work. We asked you, for those that participated, to identify 300 members that represented your membership as a whole to distribute the survey over a couple of weeks. And we've heard back from 1,078 of our shared members and learners, and this information we think will be incredibly helpful. So this is again, preliminary data, and what you'll see probably most important in those first two items is that the preference, again, we asked preference for learning as a result of the pandemic since March of 2020. And what we see is the preference for in-person has declined, and the preference for virtual has increased. The others have stayed mostly the same. We do have some open-ended responses and other questions to analyze more closely. We can certainly look at this. We collected some demographics, which will be interesting. But we know that learner preference has changed in response to the pandemic and what we've offered over the last couple of years. So kind of our ahas. Pivots are now the expectation. So we worked hard to do that 2.5 years ago, and now the expectation is we continue to make changes to how we offer education to our members, to our learners. The data show both at the organizational level and learner level that the pivot was real. It happened across the board, regardless of our specialty society. We recognize that these changes are here to stay in many cases, and we're all experiencing that in trying but also innovative ways at our own institutions. There's a real opportunity here to continue to track this. Do we return to any of the past? Do things stay different? And how do we evaluate the impact or the meaning of this change? Do we know that our education is meeting the needs of our learners and ultimately enhancing patient care? And we can share that certainly using CMSS PPG, that using ourselves together, using our group together is really much more impactful to look at what has happened across specialty societies, across our membership, is going to be much more beneficial than if we did this sort of work on our own. What's next? We look forward to analyzing the learner data in more detail, comparing some of the learner data with the organizational data, what our perceptions were as organizations, and how did that compare to what the learners told us. We're going to hold these focus groups, so we'll come back to those 25 organizations that participated and ask you to identify or help identify members or learners who will engage in these focus groups so we can dig down a little bit deeper around learner preference. We're in the process of writing a manuscript, which we look forward to contributing to the literature in this area. And again, this has been a wonderful opportunity for us to really leverage or recognize the benefits of coming together as organizations across CMSS. And we're thinking about endless ways to continue to collaborate to make a difference in patient care. And I'm going to ask if my colleagues, co-presenters, have anything to add that I may have missed. They're thinking and debating.
You know, it's the great thing about this is, first of all, we started to kick this off with just the community itself and everybody's participation. And when you think about that, we had 36 of our organizations out of 47 that participate. That's huge when you think about it. So this data is very powerful. And even the member data that we have is very powerful, and it's really writing a script for the future. And we talked a little bit about this with the CEOs yesterday, but taking a look at and thinking about how we can plan for the future, how we can look at med centers and residencies right now to see how education is happening there so we can plan for the future. Because if you think about that fourth year right now, it's in med school. They're going to go maybe, let's say, a high-end seven-year residency. They're coming out in 8 years. 8 years from now, what kind of technology are they going to expect? If we sit and we create education that has people in a room watching PowerPoints, is that how they're being educated today? And I would venture to say they are not. We are seeing a lot more problem-based, case-based learning. We're seeing a lot more podcasts for lectures. No more of these, big rooms. And they're coming out of med school with that. They're coming, and more simulations and all that. They're coming out of that residencies with those. How are we going to create our education now for when they get out and become consumers of CPD in the future? Especially if they don't have, when they come out, the wherewithal to come to events like this, to learn more, and they have to stay back home and get more of their stuff digitally. How are we able to solve some of those problems? So now's the time to be thinking about those folks that are going to be coming out, and we plan for that.